With this Capitol Report Extra, I'm Shannon Loehrke. We've been hearing in the news about the many challenges healthcare facilities are facing in addressing the COVID-19 epidemic. In Minnesota, Senator Michelle Benson championed a bill that puts forward $200 million for planning, preparation, and response efforts. Senator Benson, thanks for joining me.
I'm glad to be here.
So you released a statement just a few days ago urging healthcare providers to apply for short-term emergency grants. I believe there's several kinds of grants that are available. What's available and how will this money be used?
Well, the first batch of money we sent out actually a couple of weeks ago was $21 million to the Minnesota Department of Health so that they could begin to prepare with testing, personal protective equipment, and the resources needed to stand up our public health system to respond to the COVID outbreak. The second batch of money, $50 million to go out quite quickly to hospitals, nursing homes, emergency medical services, and pharmacies in order to help them prepare, train their staff, acquire personal protective equipment, again, expand our testing capabilities in preparation for this COVID outbreak. Some of them have been working on this for more than a month. This would reimburse some of those expenses, and others would use this to kickstart what will be the next step. There is a third batch of money coming, $150 million, that will be to those same entities for a lot of the same purposes, but it will be based on financial need of the institution and also do we have an outbreak in that area? We want to make sure the money is going to where patients are and not just to every hospital. Although every hospital is preparing, every hospital might not receive patients, and so we want this money to go to those hotspots.
From your discussions with people in the medical community, where are the greatest needs in addressing the pandemic?
Their biggest concern is always the safety and health of their employees. Personal protective equipment is an issue. Lots of people know that there are shortages right now in personal protective equipment. I will tell you, everyone I have talked to is working on ways to get that equipment to our healthcare providers. And why the healthcare providers? Because as long as they're healthy, they can care for sick Minnesotans. The second thing that the hospitals are looking for is to make sure they have resources to care for people should this epidemic become the outbreak that people are starting to model. And so do they have the right number of ICU beds? Do they have isolation beds? Can they convert places in their hospital to other types of beds, or can they convert an entire hospital to a COVID response facility? And those are some of the things that they're working on right now.
So the legislature is about to act on a third COVID-19 package. In general, what kinds of support will be offered in this next package?
This third round looks at the next tier. For example, homeless people that might need to be quarantined, or homeless people that get sick and need a place to stay, but maybe not hospital level care. We're also going to be looking at food supports for the elderly who've been asked to shelter in place, and maybe they relied on Meals on Wheels, and Meals on Wheels isn't able to deliver to their house because the local restaurant that supported Meals on Wheels got shut down. And so those are the kinds of things that are coming in this next round.
Senator Michelle Benson, I want to thank you for taking the time today.
I am so glad to be here. Thank you for making this work.